All right, welcome everyone. Thanks for joining us for our Wisconsin Coalition for Social Connection meeting. I am going to jump right into it. We do have a pretty packed agenda, so I want to leave enough time for our speakers. But I do want to start with just some introductions and see who's all on the call today. So if you want to drop your name, your organization in the chat, and I just have a quick icebreaker question for us today. What is a topic that you have been curious about lately? I'll start by just sharing my name and introduction. My name is Suzanne Morley. For those of you that don't know me, I am a health promotion program coordinator with the Wisconsin Institute for Healthy Aging. And as of the first of this year, I have taken over coordination of this coalition, the Wisconsin Coalition for Social Connection, previously called the Wisconsin Coalition to End Social Isolation and Loneliness. Topic I've been kind of curious about lately is making everything from scratch. So I have just recently started making my own English muffins. I've been kind of looking into make my own pasta. So if you've ever done that before, feel free to send some tips my way, but just something I've been really curious about and interested in lately. So like I said, feel free to drop in the chat so we can kind of chat along throughout the meeting. But I am going to get right into it with our agenda. We do have a couple of presentations today with some really great information to be shared for this meeting. So we have Allie and Meredith from US Aging, who are going to talk a little bit about the nationwide network of champions. We have Caitlin and Sally from the Wisconsin Board for People with Developmental Disabilities, who are going to talk a little bit about peer mentoring. And then at the end of the meeting, I will give a few coalition updates. I want to welcome first Allie and Meredith with US Aging, and I will let you take it from here. I'm going to stop sharing so you can share.
Awesome. Thanks, Suzanne. And it's nice to be here and see so many of you here today. I'll jump in first and then I'll pass the baton to Allie. But I'm Meredith Hanley. I'm a program director with US Aging, which administers the Commit to Connect initiative on behalf of the US Administration for Community Living, a federal agency. And as I mentioned, I'm joined by Allie Fellhaber, and she's a program manager with US Aging. So today, I think we have 15, 20 minutes, right, Suzanne? Thereabouts? Okay. So today we're going to share information on Commit to Connect's nationwide network of champions platform. It's an online networking platform that now, a new development, has a community just for this coalition. So it's kind of an extra tool that you all can choose to use, where you can engage and connect between your regular coalition meetings. So we want to a brief summary of what Commit to Connect is all about for anyone not familiar, but primarily we'll do a demo of the platform and show you how to access the Wisconsin Coalition for Social Connections group and enjoy the benefits of the platform. And we'll try to save a few minutes at the end for questions. So next slide, Ellie. The Administration for Community Living, in partnership with other federal organizations, established Commit to Connect in 2020. So the project first did start as a result of the pandemic, but with plans to continue well beyond the pandemic now. The overarching vision is to help connect people living with isolation with programs and resources to build the social connections they need to thrive. And the initiative works across different population groups, but really with particular emphasis on aging and disability. US Aging, the organization that Allie and I both work for, is a national nonprofit based out of DC. We serve as the coordinating center for Commit to Connect. So we do a lot of the implementation for the initiative, but under the leadership of the Administration for Community Living. And we do have a website, committoconnect.org. I can pop it in the chat after I finish speaking, or you can just Google it yourself as you wish to dig into our website. Next slide. In terms of strategy, Commit to Connect works to increase awareness and availability of programs and strategies that address social isolation and loneliness. One of our key emphases within Commit to Connect is partnership. We work with a host of other organizations who also care about addressing social isolation and loneliness to help leverage our collective efforts. And I'd say that's one of the reasons that we're here today and happy to share this nationwide network of champions platform with you, and also specifically address this, establish this community for the Wisconsin Coalition within this platform as well. Next slide. I'll just briefly highlight some of the key efforts that we have as part of Commit to Connect in case it would be helpful. As I mentioned, and this is the effort that Allie will take a bit of a deeper dive on, is one of our key efforts is cultivating what we call the nationwide network of champions. And we cultivate that group through an online networking platform. And that platform's aimed at folks such as yourselves, people who are passionate about dedicated to ending social isolation and loneliness. So we have this platform. It's through the Higher Logic system. And we use it to foster online discussions and share resources and share events. And that's the platform that Allie will specifically, again, demo in a couple minutes here. We also do a lot of events. So we have a national summit to increase social connections. We do that annually. That's actually coming up next month, May 14th and 15th. So again, I'll put a link to our website in the chat here in a minute, but you can find more information on that summit. But we also do regular webinars. All of our webinars also include a half-hour office hour section, we call it. So we have a 60-minute webinar plus an optional 30-minute just kind of discussion component of the webinar. And then sometimes we do separate peer exchange sessions. So really just kind of open discussion networking sessions. So we try to have different formats to suit different kind of topical interests, but also different ways to engage with other people. Some more educational kind of speakers presenting out and some more networking focused. We develop different TA materials, technical assistance materials, and we've produced some materials specifically recently on social engagement and rural issues, social engagement and intergenerational issues, and social engagement and supporting people with dementia. We also have community of practices, which are learning, kind of like learning communities. Right now, we have one focused on measurement and evaluation of social isolation and loneliness programs. We'll be sharing results from that community of practice soon. Next slide. But again, one of the things that we're really excited by is our nationwide network of champions. And that's what you see on your screen now is a screenshot from that platform. Our platform now has over 440 active members with over 380 organizations represented, including, I believe, some of you on the line today, and we hope all of you on the line today shortly. I hope you consider signing up if you haven't yet. As you join the platform, you'll see that there's a pretty wide array of types of organizations and people represented. You'll see people from kind of the local sector, from state organizations, as well as from national or federal organizations. It might be aging and disability service providers, area agency on aging staff, could be a business leader, it could be an intergenerational program leader, it could be a foundation or a university researcher, senior center staff. So it's a broad array, but again, these are all people who care about addressing social isolation and loneliness in kind of in the setting in which they work. And so members of this platform, we call them champions, have opportunities to connect and network. And the platform has sections for communities. We have one open community forum. So that's really, any topic can be posted there. We also have an intergenerational forum focused on people who want to discuss that topic. And then now we also have a community specifically for this coalition, again, as a tool for you all to engage and connect between meetings. But the platform has a lot of other features, discussion threads, resources, events, and the like. I think the main benefit of this platform is just that opportunity to connect and share resources, and also to connect, obviously we're setting up a community for this specific group, but you'll also have opportunities to connect with peers all across the country who may have similar kind of interests as you, and you can learn and share with each other. At the bottom of this slide, I put a link to specifically how to sign up for anybody who's not part of that, who's not part of this yet. And I'll place it in the chat as well, so you can click the link, which I know you can't click from the slide on the screen. Next slide. And this is just the contact information for me and Allie, and information, again, how to sign up for the platform, our general email address, our website address. I'll place some of those links in the chat for easy access. But more importantly, I want to turn it over to Allie, who will show you the system itself.
Awesome. Yes. Thanks, Meredith. Thanks, Suzanne, and the whole coalition for having us. We're so excited to launch this new community for you all and hopefully have you all sign up to be champions. So I'm going to stop sharing here and I'll pull up the platform so you guys can see. Pull it up. I'll share my screen again here real quick. So as Meredith will be dropping the link in the chat, and as we said, if you're not already a champion, we definitely encourage you guys all to sign up. We think it's a great way to connect with others, and especially between your meetings, being able to connect and collaborate. We hope it'll really benefit you all and kind of build on the great work that you guys are all already doing. So if you haven't signed up, it's just a very brief form that you'll fill out. We'll receive your registration, we'll go in and accept your application. And once you're accepted, you'll have full access to this platform. So this is the homepage when you log on that you will see. And I'll kind of just briefly go through and highlight some of those features that Meredith was mentioning. As she highlighted the communities, everyone, when you sign up, is accepted into the open forum. So you'll be part of that community. In addition, we will be going in and adding you to the private community that we're setting up that only you will have access to. So only members of the coalition will be added to that private community and be able to view that page. The first thing I will touch on is the discussions. As Meredith mentioned, this is like one of the most popular ways that we see people using the platform. It's a great way to raise questions for the group, seek input, share stories. I'll briefly show you guys here. You click on all the discussions. Well, there we go. You can kind of get an idea of how people are using the platform. Again, like I said, seeking input, sharing ideas, sharing funding opportunities. So it's, yeah, a great way to connect with others in your community. And I wanted to, again, highlight here, you'll see the open forum, and also, as we sign you all up, the Wisconsin community. So when you're navigating from these top navigation, I just wanted to highlight too, you'll see all of the community information from both communities. If you wanted to view just the Wisconsin community, I'll get into that a little later and how you navigate to that page. The other main way that we see people using the platform is through sharing resources. As we all know, we're not trying to reinvent the wheel. So if there are resources out there that you use, we definitely encourage you to share these. So you'll see in our current resource library, all sorts of resources have been shared. You can submit really any type of file, whether it's PDF, docs. We post our webinar recordings. You can link to YouTube or share other hyperlinks. So any resources that are really helpful in your work in the realm of social connection, we definitely encourage people to share. And we really hope to continue building on the resources that get shared here. The next feature I'll touch on is the events. Again, we think there's so much great work going on and so many different events within the communities that we definitely encourage folks to post and promote those events here as well, especially I think within Wisconsin, whether you're doing something that's local in your community in person, or maybe you're hosting a webinar. I think this is a great way to promote that and encourage the coalition members to kind of link up through these events. So that's another great feature of the platform. Lastly, I'll just touch on very quickly, the directory is another feature where you can search by organization or by individual. So you can get really a good picture of all the folks who have joined already. And kind of similar to like LinkedIn, it's a great where you can find individuals and connect with them as well. So I'll now circle back. I wanted to show you guys the specific community that we've set up for you all and how to navigate to that. So if you're getting on through the homepage, you'll want to go to the communities tab and hit my communities. If you are signed up right now, again, you won't see this right away, but we'll make sure that you guys are all added to this very soon. Then you'll be able to scroll down here to the Wisconsin community. So the navigation is almost identical to like the main navigation of the platform. There's tabs for discussions, libraries, blogs, events, members. So just to kind of, again, differentiate, anything in the open forum is open for everyone to respond to. Any discussions, resources, events that you post on this community will only be viewable and accessible by folks that are in this Wisconsin community. So again, we definitely encourage you all, and you're more than welcome to participate in the open forum. I just wanted to make sure that you all are mindful if there's something that you only wanted to share with the Wisconsin folks, that this goes here. I wanted to highlight as well the discussions. We did have Suzanne jump in and kind of introduce herself. So as you all are joining, we hope you'll kind of take the initiative and introduce yourself here as well, reply to that thread. And then at that point, yeah, you're really open to any questions you have that you want to share with the group, any resources. We really hope that this resource will be something that's beneficial to you all, kind of connect and build on the work that you're already doing. Other than that, I think that was kind of like the broad overview. I wanted to highlight a couple of other small things with the platform. As you're signing up, we definitely encourage you as well. In this top right corner, you'll see a little circle that will take you to your profile page. Very similar to LinkedIn or any other social media, pretty customizable, where you can add your own little bio. And I think that's just very helpful, especially with a large group like you have. Everyone might not be as familiar with each other, so it's a great way for people to learn about you and the work that you're doing. And on your profile, you'll also be able to access your account settings. So if you ever need to adjust the notifications or anything along those lines, that's how you can access it there. But beyond that, we think it's a really great platform and it's continuing to grow. So we hope that you all will sign up and this will be something of interest to you. But I think at that point, I just wanted to see if there were any initial questions with the platform. And of course, if you don't have any questions right now, you are more than welcome to reach out to Meredith and I. We definitely hope you'll sign up and explore, and maybe as you're exploring, you'll have some questions. So
I did just see one question pop in the chat too. Is the platform intended primarily for professional use, or is the invitation to kind of open to other individuals who might need services or have other needs? And it is aimed for social isolation and loneliness, or kind of a related area where this kind of ties into your work in some fashion, maybe kind of directly or indirectly. So yes, it does have that professional focus, kind of peer exchange and networking focus amongst individuals working in this space. Good question, though.
Thanks, Allie and Meredith. There are, just to share for other people on the call, there are some videos and some additional resources on how to use the platform on the website. Is that right? Kind of a little more in-depth of demo?
Yes, if you go to this FAQs page, there should be like a quick starters guide. I think as you sign up too, you should receive a welcome email, which will have those links as well.
Awesome. Yeah, lots of great resources. We're super excited to share this with everyone and invite all of you as coalition members to attend and network with people, not only in Wisconsin, but even nationwide, but really excited to have our own Wisconsin network where you can share, hey, are any other senior centers doing anything like this, or ADRCs or health departments, whether it's related to intergenerational mentoring or anything else related to social isolation and loneliness. So again, super excited to have this available, and we'll share out more information in our network emails too. There's just one more question I see. Do you have resources that share funding opportunities?
We do share, as we learn about funding opportunities ourselves, we will post them. And also with this being a federally funded initiative, sometimes our federal partner will, learn about funding, whether through whether through ACL or another federal agency. So kind of we post things as we learn about them. Other folks are encouraged to post things too, as others learn about funding opportunities. We do tend to keep the ones we post more like national in focus, just because I guess that's what we tend to learn about. That's also broadly funding is an interest for folks. It always is. We did a survey recently of champions too, in terms of like content they're interested in. Funding always comes up. So certainly we'll keep on posting funding opportunities as we learn about things.
Yeah, great question. Definitely encourage you to post about ways that you've used funding, different innovative ways you found different funding streams too. That would be a great way to engage and start a discussion around too.
It's a great idea.
Anything else to share, Allie or Meredith?
I don't think so. I think that was a snapshot for today. Hopefully that helps give people a little background on what this is all about. But as Allie said, if any questions arise, just give us a holler. Email is a great way to reach us. But yep, we can be a resource as any questions come up. But hopefully this was a good overview.
Awesome. Thank you both. And like I said, we'll send out more information and the link to join the Network of Champions in the email with the recording for this meeting. All right. Thank you both.
Thank you.
Hate to move on so fast, but we do have, like I said, a packed agenda. So I am going to move on to our next presentation. We have Caitlin and Sally from the Wisconsin Board for People with Developmental Disabilities to talk a little bit about peer mentoring. So I am going to let you both take it away.
Sounds good. Thank you. We're excited to talk about a project that we're working on. I'm Sally Flashberger, and I am the project manager for a grant called Living Well. We are housed at the Board for People with Developmental Disabilities, and Caitlin is pulling up the PowerPoint, but it looks a little wonky. I don't know if it does for other people, but it does on my screen.
Yeah, there's just a couple of black boxes. You might have to move the people around or something like that.
And once Caitlin gets it up, I'll have her introduce herself. So we have been working on yeah, that's so weird. Why is it doing that?
I don't know. Give me 1 second.
Okay, I'll just get started. So we have, so I'll tell you a little bit about our grant. Caitlin's our project coordinator. I'm the project manager. So we have actually been working on a grant from the Administration on Community Living for 5 years. And the focus has been on people using home and community-based waiver services and really looking at quality home and community-based services, but also looking at kind of the community monitoring around abuse and neglect systems in our state. And through that grant, we had several service providers that worked with us who provide home and community-based services, and also several individuals with lived experience that we call self-advocates, and they were working on the grant with us. And so our providers and our self-advocates were working together doing education around, it was around rights, it was around kind of self-determination, self-empowerment. And so our model was that our advocates worked with a site, and they did peer-to-peer education in groups. And so as we were working through that, we really saw that there was a need for people to be working individually. Let's see. Let's see if we can get it up. That looks good, Caitlin. All right, so
That's
we
Suzanne. Thanks, Suzanne.
Yeah,
Oh,
let me know when you
Suzanne.
need to move to the next slide.
Okay, I'll tell you. Okay, great. So we developed 3 educational tools: our Healthy, Safe, and Connected toolkit that has been used with the coalition, our Safe and Free series, and our Let's Talk About Rights guides. Next slide. So we really saw that people wanted to connect more individually with our self-advocates. So as I said, we started with these peer education groups and with our service providers. And then as we saw people wanting more individual kind of service, we began to explore what peer mentoring looked like. And so in Wisconsin, we already have a model that is used in our mental health services. So we have peer specialists, which are people with mental health diagnoses that have that lived experience. So similar to that. So we began reaching out to other states to see who was using peer mentoring for people using long-term care. Next slide. So why is peer mentoring important for social isolation and loneliness? We'll kind of get into the details, but I think it's really important to understand what the connection might be. And really that peer mentoring can offer that connection and that individualized kind of planning for a person about what they want their life to look like. And so we always talk about those connections to other people, whether it's friendships or family, your community members, kind of that wider circle. Often people with disabilities and even older adults, a lot of the connections they're making is with a paid worker. And so we're always trying to think about how to expand their community beyond the people who are being paid to support them. And so what we found is that individuals with disabilities were really looking for ways to find those different community services and to really participate in their communities by and trying to overcome those different barriers. And peer mentoring really offers that kind of back and forth of developing a plan, staying motivated, continuing to have those conversations about how a person can improve their life and feel more socially connected. We know from the Surgeon General's report that came out late last year, social isolation and loneliness is, a key factor in people's lives and health. And even in that report, they did emphasize some of that that peer mentoring, that the research shows that peer mentoring can work, not just for people with disabilities, but older adults. And so we really thought it was important to test this in our state. Next slide. So the purpose of our peer mentoring program was really to look at individuals with intellectual and developmental disabilities and to look for those opportunities to mentor and assist them. And the goal for us is really to achieve that community inclusion, to really be a member of their community and to be able to participate as independently as possible and really give people the tools of that kind of self-empowerment, self-determination, that they can really feel like they are being part of their community. And we knew that the best way to do that was by other people who already have those lived experiences of building connection and finding ways to be better included in their community. So our peer mentors will offer those personal experiences, but also encourage and help the person work on their own advocacy. Next slide. So we looked at several different states. We met with Michigan, Georgia, and North Carolina. And in Wisconsin, for home and community-based services, we really want to see this added as a service in what's called our waiver, so Family Care and IRIS. And so we reviewed different waivers from those states to see how they were determining what peer mentoring would look like. As I said, we looked at the Wisconsin mental health model. Michigan seemed to closely align with what we were intending to do. So we really worked with Michigan and we put our self-advocate leaders from the grant. We had 8 people go through a 3-day training to become peer mentors. And now we are embarking on a pilot because the Michigan model was really a training model and then an internship model. So we're very excited because we are participating. We are starting this model where they are going to start peer mentoring. The other opportunity was Optum had developed a pretty extensive peer mentoring training, which we do have available, and I can follow up with Suzanne. It was a little more in depth than we were intending to do at this time, but it really is a great model. So that was another resource that we took a look at. Next slide. So I'm going to tell you a little bit about what we're doing, and at the end we'll kind of, I'll give you why we think this is important for everyone to know. So we have been starting to implement this this pilot with 2 provider agencies, Aptiv and ODC. We intend to mentor 20 people over the course of our pilot, and eventually, once our mentors go through the internship, we hope that they will be employed by the providers into the future. We've also we've adapted the Michigan training for our own Wisconsin peer certification, and we will be offering a training later this year. But again, this is another way for individuals with disabilities or even older adults to get involved in becoming a peer mentor. So we're really looking for that opportunity in our state. And we've been working closely with the Department of Health Services to talk about how peer mentoring can become a waiver service. We do have it in our children's waiver right now, but it's really not listed in our adult waiver. So they are allowing us to use some other coding right now to be able to allow the pilot to go forward. But we really think it's important that we kind of build some other advocates to be out there really talking about peer mentoring as a service that would be important to help reduce social isolation and loneliness. Agencies would employ the peer mentors, and they would be able to charge Medicaid, so home and community-based waivers for those services. So that's what we're kind of piloting right now, is the use of using some of these different codes, and hoping it will eventually be added into our waivers. So these are 2 of our peer mentors. We have 5 who have decided to continue on. They are just getting started, and what they'll be doing is they'll really be providing supports through the benefits of their shared experience. So they have lived experience, they're using our home and community-based waivers, so they can talk about what services and supports a person might need. So for example, maybe somebody maybe they're living in a group home and they want to live independently. So Ashley or Priscilla might be able to talk to them about the steps that they might need to take and how they can work on that. That could be helping them talk about how they might talk to a family member about that. Maybe a person just wants to get connected in their faith community. And so, the peer mentor is really there to help the person develop a plan of what's important to them. They're there to encourage. We always talk about, you're not there to tell someone what to do. You're there to really bring their ideas out and help them have a comfortable conversation. We found that people are more apt to talk to a peer than they are necessarily the service provider when they're trying to make change in their life. They can assist with their person-centered planning. We hope that they will help build bridges to resources in the community. So the peer mentors may be searching for opportunities for the individual that maybe the individual didn't know about. They may work with the person to really kind of build that plan for activities. And then again, as we've talked about, we really think this will decrease isolation and loneliness, that people will begin to make those connections in their communities, or even feel self-empowered to be able to do that themselves. Next slide. I think it's going to Caitlin from here. Yep. All right, so this is a video. Let's hope, we think it'll work, right, Suzanne?
I have the link pulled up, so I can
Okay.
just share that part.
Okay. Otherwise, I was gonna say I have to share my sound, but if you want to do it, that's totally fine, Caitlin.
Yeah. give
Yeah,
me
so
one
we
second.
created several videos. This is just one of our rights videos, but it gives you a flavor.
You're watching the Self-Determination channel. Today on Know Your Rights, we're talking about supports and services.
Did you know you have the right to choose your supports and services?
You can choose who supports you.
You can choose the services you want because you have a disability.
And just like people without disabilities, you get to choose where you get your services. Things like where to get a haircut, where to eat, and where to buy your clothes.
Here are some ways to help you make good choices.
Talk to agencies about how they can support you before you agree to get support from them. Decide if they have the supports and services that you feel are best for you, not what they think is best for you.
If you don't like a support or staff person, speak up. Let the agency or your case manager know.
If a support person isn't letting you choose your services, ask them why. Tell them it's your right.
Hi, I'm Christy from Watertown. Choice is very important to me. It's important for me to choose who my caregivers are. It's my choice to decide who comes in and out of my home. So I need to be involved in the hiring process and feel comfortable. My caregivers are doing personal cares with me, so it's important that I trust the person and believe that they won't violate my rights. And I can give them permission, and it can change day to day how I feel.
I'm Priscilla, and I live in Milwaukee. As a person with disabilities, it's important for me to choose my services and supports for my quality of life. I get to decide with a disability or not what I want to make the best life for me. I get to decide if I want to go to school, if I want to get a job, if I want to volunteer. It's totally up to me. It's my life, and I get to make the best choices for me.
My name is Ginger from Oshkosh. It is important for me to choose my own caregivers and decide what I want to do on a given day.
Talk to people who support you and tell them what you want.
They should support you to shop and get services where you want.
Explain why your choices might be limited.
Help you change staff or services if you do not like the ones you have.
Live your best. Choose the supports and services that are best for you.
Check out all the videos in our Know Your Right series. The links are in the description below.
Subscribe to our channel. It's free. If you click on
I wanted to show a video because there are a couple of our peer mentors in there, Priscilla and Christy. Ginger has also gone through the training, and I think it just highlights that these are advocates who have a real passion for helping people think about their lives and are very willing to share their own personal experiences with navigating the system. And so those are the kinds of qualities that our peer mentors are sort of taking into this new role. So this is from our Know Your Right series, which was a different curriculum or set of trainings that these self-advocate leaders were a part of, but the same sort of philosophy kind of carries through into this peer mentorship that they're now doing at agencies. Okay, next slide. So like Sally was saying, the peer mentor relationship with people that they are serving is really designed to be individualized to that person. So there's a lot of different things that peer mentors may be doing. They may be connecting people to resources, looking at volunteer opportunities in their community, talking about the kinds of skills necessary to either get a job, navigate transportation, start a new activity. One of the things that peer mentors often are asked about is the ability to move towards independent living. So looking at like what the steps are that would be necessary to move out on their own into in their own apartment or in just to a different living situation than they currently have. Navigating transportation systems, like I said. And then this is an important one for social isolation and loneliness. The peer mentors will help people connect to recreation and community participation as people are looking for things that aren't service-based to be involved in. We think that peer mentors are really going to be a key tool for people as they're making person-centered plans, because they can, a lot of times people don't know what they want until they're asked about it, or until they hear somebody who has done this and asserted their rights do it, you know, in front of them. So they may have lots of ideas that they are keeping to themselves about what could be part of their plan. And the peer mentor is really there to encourage them to think innovatively and broadly about what it is that they want with their lives, and not be afraid to ask those things outside of maybe the typical, you know, personal cares or daily living skills that that kind of come up in these person-centered planning meetings. And that really leads into this, just the support to develop self-determination and self-advocacy skills. It is being modeled by these peer mentors with them. They're sharing their own self-advocacy and self-determination journeys. They're willing to share, you know, where they started and how they've gotten to the place that they're at, and give people the encouragement that it is possible for individuals to assert their rights, to make plans for themselves, to be involved in their communities, and to advocate for all of those things. I will just say, like, you know, there are self-advocates and peer mentors who have a history of being shy and quiet and not very assertive in what they want with their lives. And to see them now, you wouldn't believe that that is the same person who, you know, we maybe interacted with for the first time years ago. And so we know from experience working with these peer mentors that the opportunity to share and learn from their peers has really given them a whole new perspective on what's possible. Next slide. So the things that we were looking for when we were, you know, deciding to build out these peer mentors was that we wanted them to be able to assist others in building their own independent lives. So not just being able to share their own experience or be encouraging, but to really help people make plans to, you know, start from square one and build towards a tangible outcome. And then be there to support the self-direction and empower people to make the decisions, and, you know, not to put limitations around what is possible for somebody's life, but helping them speak up for themselves, but also make that plan. And then educating about rights. The Know Your Rights series is and the Know Your Rights guide and the Let's Talk About Rights guides is a comprehensive look at all kinds of different rights that people have, not necessarily just their member rights or service rights, but their human rights. It can be talking about making a plan to vote. It can be if your right to go back to school and get an education. It can be your right to have the friends that you want to have and to talk and be around the people that you want, to own the things that you want. You know, so they really do look at the whole person and all of their choice-making rights and encourage them to know and exercise those rights, and make others who support them aware that they want to exercise some of these rights more. And then they are bridge builders to people and resources within the communities. They are very active in their communities now, and know how they got to that place. They may be working with somebody who's not in their local community, but that doesn't mean that they don't know the kinds of resources or places they went to build strong and full community lives. And they have been trained on how to find resources in local communities to help with that. And then building and including a circle of support for people, how to bring your family member or your guardian into the conversation while still being the person at the center of the planning, how to, you know, find natural supports in your community, how to ask for support and in building that community from people you may have interactions with that you could, you know, enhance or build on. Somebody who you talk to when you go to your, you know, your faith-based organization once a week, but who you've never asked if they could get a coffee with you or help you get there, things like that. So it's really an ideas, you know, generator for looking at the network of natural support and how you can build that out so that you are more connected to your community. Okay, next slide. And then there's some, you know, pretty standard, more, you know, nuts and bolts requirements for the peer mentors. Our peer mentors have to be 18 years of age or older. Our group of peer mentors has to be a person with lived experience with an intellectual developmental disability. You know, as we're looking to grow, it may include older adults and or people with physical disabilities, you know, but that people are connected to somebody who shares their lived experience. It's, you know, it can be, it isn't like, oh, everybody who has a autism diagnosis is only allowed to have a peer mentor with an autism diagnosis. It can be a much more fluid sort of matching process than that. But the idea is that they have experience within the system. They know that these kinds of things come up and that they are an avenue for support. And then they have to have attended the Wisconsin's peer mentor training, which Sally talked a little bit about, and complete a 90-hour internship with a service provider, which our current set of peer mentors have just gotten started with. They went through an interview process. They were hired directly by the agencies they'll be working with. They had to do all the same things that any other employee from that organization would need to do. 45 hours of that internship is required to be one-on-one peer mentoring, where they're having the opportunity to practice these skills, get feedback from a supervisor, you know, learn how these interactions will go, build trust relationships with people receiving services. The other half of that is professional development opportunities, as well as the ability to, you know, go through the same training and onboarding and staff meetings that any other person working for those agencies would go through, so that they are embedded fully into the work culture that they are working with. And then participate in annual continuing education trainings to maintain skills and expand on their knowledge base. So we continue to work with the peer mentors to learn about opportunities where they can be, and oftentimes they bring them to us. They say, hey, we just heard about this, you know, the ARC is doing something on social connection, or the ARC is doing something on self-advocacy. Can I go to this as part of my continuing education? And we take a look at those things and help people access opportunities to continue to grow in their strengths as peer mentors. Okay, next slide. So as part of this pilot, we have engaged a couple of the family care managed care organizations. 2 of them are participating in our pilot. There's a monthly learning collaborative with the agencies and the managed care organizations where we can troubleshoot things as we're learning on the fly. So, you know, this is the first round of peer mentors being embedded at agencies that we've done this with. So we are, you know, identifying things like a pathway for agencies to bill for peer mentoring services, working with the pilot sites to identify mentees, so people who are working with an MCO who the MCO care managers feel would be a good candidate for receiving peer mentoring services, getting them connected to the agencies that have peer mentors. And then, like I said, participating in this learning collaborative with the pilot participants so that we can learn together, and supporting the peer mentors, supporting peer mentoring as a service as we work to embed this fully and long-term into Wisconsin's service model. Okay, next slide. The service agency role, we're working with a couple of different pilot site service agencies. They are working, like I said, in this learning collaborative with the MCOs They are doing the training, the documentation, the contract requirements. They've hired the peer mentors themselves. They have gone through this typical onboarding process. They are working with them to use their tracking tools, all of the things that they used in their service provision. They are providing the supervision and support during the paid internship. They are the ones who are like joining in on the peer mentoring sessions to offer feedback and advice afterwards to the peer mentors, to help them identify local resources that might be useful as a peer mentor is working with somebody on a goal. And then they are ensuring the typical responsibilities of the employer are upheld, like training and scheduling and contract requirements and performance reviews and things like that. Okay, next slide. And then our role has really been to sort of be the connector piece for all of these things, as well as offering the training. We are managing the relationships with partners and the stakeholders to gather content and ideas, to find new partnerships, to continue to grow this. We have done and adapted the Michigan training for the peer mentors. They went through the Michigan version originally when we were first testing it out. We adapted it and did a refresher course with them for Wisconsin specific resources, as well as some of the highlights of what peer mentorship looks like. And then we are helping to train the supervisors at the agencies and work with the managed care organizations to make sure everybody is on the same page as we work through this. Those monthly learning collaborative meetings happen both with the pilot sites and MCOs, but also with the peer mentors themselves, where they can have an opportunity to discuss what they're learning and what they're experiencing as they go through the process and give us some feedback on where they need support or where something that we haven't thought of has come up. And then we are working with Wasteman Center on an evaluation of the pilot project as well. And we hope to train a new cohort of peer mentors this summer and hopefully be able to embed them in some agencies as well and get a whole new set of peer mentors out there. Next slide. All right.
I saw some questions in the chat, which I answered, but I'll answer them out loud in case others didn't see that. So we are hoping that the peer mentors will be able to continue on to be employed with our agencies. And what happens, how they charge is through Medicaid services, through long-term care. And so we are testing a coding right now, but it is not part of our family care IRIS waivers. And again, we need your advocacy because the family care waiver is coming due and there'll be time to provide public comment. So anyone who's interested in seeing this in our waiver, be sure to do that when that comes out later this probably spring, I think it'll be. Somebody asked, is there a standard length of time an individual would work with a peer mentor? And it really depends on that person's goals. We haven't really put a period of time on it. It could be for multiple months. Maybe they're working on a particular issue, they develop a plan, and that person meets that goal, and then they don't necessarily need a peer mentor, but they may find that they have that relationship, and then the person says, okay, great, I did that, but now I want to try this. So good question. There is not necessarily a voc agency, like you might think just vocational agency. ODC definitely does provide vocational services. I don't know if Aptiv does, but we haven't really looked at just working with voc agencies, but a good question.
Can I elaborate on that question?
Yes.
Actually,
Mm-hmm.
So my question was, that's good to know. But my question was, does the peer specialist have like a worker with them?
So we yes,
yeah.
We did talk to DVR about this because they do allow the mental health peer specialist. That is an allowable kind of job. And so they are not necessarily on board yet. They kind of want to see the pilot too. But we did have a conversation with them. And yes, if a person needed it, they could get voc services and So we did have some discussion. Most of the advocates that we're working with are not involved with Voc services at this time. They maybe have been in the past, but they aren't. And they are working for disability organizations. So it is, that the kind of, I think support is kind of built in. But if needed, yes, we've all talked about how they may need to get additional help. And then any thought to peer mentor services available fee for service? No, we haven't really talked about that yet because we know that our system is good and we just need to kind of figure out how we can build it into our system. But that is a good conversation, that there may be people who are able to afford to do that for a fee per service. All right. Any other questions? I know Suzanne wanted to wrap up with some stuff, so.
Yeah, thank you both so much for your presentation. Such a great pilot project and program, and can definitely see the connection with self-advocacy and increasing social connection. So super, super appreciative of both of you presenting it. Sally and Caitlin's contact info is on the screen. If you have any additional questions, please reach out to them. But do just want to wrap up real briefly with some coalition updates. So I just wanted to share that our coalition has been working hard the last few months. We currently have a website. Previously, the coalition materials were housed on the WeHow website, but we're creating our own standalone website. It's currently in draft form, but we are excited for it to go live sometime this year. There is a space on the website for both consumers, so older adults and people with disabilities, and professionals. So look out for that coming in the next few months or so. I wanted to give a brief update on our ad hoc committees. We recently just started 2 different ad hoc committees, one for measurement and one for awareness. The measurement ad hoc will be working on a number of things, including collecting data, and then the awareness ad hoc will be working on planning for the awareness week this November. So more details come on both of those things as well. Wanted to just remind you all to complete the coalition survey as well. That went out a couple of weeks ago to provide feedback on coalition activities, including to help plan for that 2023 to 2024 awareness week in November, and help guide other coalition activities. There are a couple of links and QR codes on the screen if you are forwarded this registration link. If you're not receiving our emails currently, be sure to sign up as a coalition member by using the links on the screen. And our next meeting will be in June. So looking forward to seeing you all then. The registration for that meeting will come out about a month ahead of that time. And the recording for this meeting will be sent out by the end of the week. Thank you, everyone. Have a great rest of your day.
Thanks a lot.